Don't panic if you miss one of your treatments. If you can, go ahead and put your trays in when you remember. It is more important to put the trays in the number of times a day recommended, even if for just a few minutes. At your reevaluation visit, you should notify your doctor if you are unable to keep the medication schedule. If you can't immediately put your trays in, just return to your normal schedule. Keeping the trays in for longer the next time will not help significantly. It is the combination of the number of times and the length of time that is helping to control the disease. Many patients order additional trays to use at their office, in their car, or wherever they need them, so they can use the system as prescribed. The additional trays cost much less than the first tray, and this is a real asset in being able to use the system to obtain the optimal results. If it is more comfortable for you, you can wear only one tray at a time. Just remember to wear each tray for the prescribed number of times and length of time every day. If you can taste your medicine, you have put too much in. Taste it, waste it is a phrase you may hear from your dentist. Try putting in less the next time you use your trays. Unless your dentist provides the medications, you will need to return to the pharmacy to get more medicine or gel when you run out. Your dentist can help you with the other supplies. Some medicine will stay effective for many months if you keep it refrigerated, so follow the instructions of your dentist or pharmacist for your specific medicine and any medications you keep in your bathroom. You may transfer a small amount to a smaller eyedropper bottle that comes with your kit to be used with your trays and brush. This will stay effective for weeks, but the main supply should stay refrigerated. It is common for trays to turn yellowish. Some of the medications have a yellow pigment in them. The yellow stain is because of the medicine, and it doesn't affect the ability of the tray to keep the medicine under your gums. You can clean your trays by soaking them in denture cleaner or brushing them gently with a toothbrush and toothpaste. Rinse them thoroughly and make sure they are dry before returning them to the case. The trays are temperature sensitive and need to be stored in a place where they will not become too hot. In a cabinet or a drawer in your bathroom is a good place. It should be a place pets and small children cannot access. And if you keep all of your supplies in one place, it is that much easier to use the trays. If the dentist says it is time for new trays, congratulations! That means you are healing, and the change in your gums has been significant enough that the old trays are not sealing quite as effectively anymore. Continue to use your trays as prescribed until the new trays are delivered. Gums that are infected and inflamed are also somewhat swollen. One of the beauties of the PerioProtect system is how quickly the infection, inflammation, and swelling respond to the treatments. It may feel like you just got your first trays, but after even only a few weeks, the medicine has been doing its job and your gums have been healing. When the healing occurs, the swelling decreases, and the seals may no longer direct the medications under the gum tissue. New trays will be fabricated to continue your treatments. This is nothing to worry about, and you should be excited at your progress. During the initial treatment phase, you will need new trays due to the healing of your gums and their change in shape, not because the trays have worn out. You will get new trays in accordance with the healing that occurs, and this will be evaluated during the regularly scheduled reevaluation appointments. Once you have reached the maintenance stage, where you are only using the trays once a day, the trays will last from 3 to 7 years before you will need new ones. If you wear your trays at night to whiten your teeth, you may require new ones slightly sooner than 3 to 7 years. Be sure to always follow your dentist's directions. Type 1 trays are slightly thinner, more flexible. The seals are slightly smaller, and the extension of the trays over the gum tissue is slightly less than the Type 2 trays. Type 1 trays are usually used for gingivitis, and Type 2 trays are generally used for periodontitis. There are exceptions to these generalities, and this will be determined by your dental professional. Due to the small amount of medicine being used, and the fact that the trays keep it sealed to your teeth, the medicine should not affect birth control medicine or anything else you are taking. Remember, if you can taste it, you are using too much, so make sure you are not overfilling the tray. However, we recommend you discuss these matters with your physician to be sure your physician is comfortable with your using these medications. There are a variety of materials your dentist can prescribe that can be used in the trays to treat the disease without affecting other medications. If there are any problems, you need to notify your dentist and immediately stop using the system until you have been thoroughly evaluated and proper regimens of care are established. There are many beneficial health effects of your trays. As the bacteria are decreased and the infection is decreased, you will start to notice fresher breath within a matter of days. Some dentists use hydrogen peroxide as one of the antimicrobial agents, and this also whitens teeth. Be sure to follow your doctor's orders in these matters. In some patients, there is evidence that the medicine also seems to inhibit bone loss and thus strengthen the bone around the teeth. There have been many articles and studies where periodontal disease may also be related to heart disease, diabetes, and some pregnancy complications. Dealing with your periodontal disease may also help you avoid other possibly related health risks connected with the bacteria you may swallow, inhale, or which may enter into your blood and cause systemic complications. The trays can be used by almost anyone with gum disease. There are some medications that should not be used for young children, so discuss this with your dentist. If you accidentally contaminated your dropper by touching the tray with it while you were putting the medicine in, immediately wash the dropper with water or alcohol and let it fully dry. You should discuss this with your dental professional, as simply leaving the trays in overnight to extend the usage time may not speed the treatment. The key to success is both the number of times and the length of time your dentist prescribed you to wear your trays. Some patients grind their teeth as part of the rapid eye movement sleep or for other reasons. Special PerioProtect trays can be used for these instances. It is best to discuss these with your doctor and determine the best sequence of treatment for your individual case. If you have a burning sensation or a sore feeling in your mouth or any other possible complications, you should immediately stop your treatment and contact your dentist, as you could be sensitive to the materials. Remove the trays and rinse your mouth out thoroughly. Call your dentist office and let them know what happened. You should schedule a visit with your dentist for proper testing, and they will prescribe appropriate therapy. If you break out in a rash, you could be having an allergic reaction to the medicine. Immediately stop using your tray and call your dentist office to let them know. You should visit your dentist for testing, and they will prescribe appropriate therapy. The scope of treatment is determined by the magnitude of the disease. More severe cases usually take longer than less severe cases, but this may vary from individual to individual. As your healing continues, your dentist may lessen the number of times and length of time each day that you use the trays. You will also receive new trays every so often that fit your gum tissue as it heals. Eventually, you will use it as a maintenance procedure to continue to hold your periodontal disease at bay. This is the best way to keep the disease from reoccurring over time and prevent returning to your previous state.